Thank you for listening to Depictions Media Radio. And welcome back, everyone. And up next, we will have a update from the Pan American Health Organization. Of course, that is the international or United Nations organization that reports on health and monitors health conditions for North and South America, as part of the WHO. And as we've heard in some other reports, and you're probably seeing a lot of headlines around the Omicron variant, and that there's still many unknowns with that. Dr. Etienne is going to reinforce that idea that there are still a lot of unknowns with it, and it may be more transmissible, and there's still some unknowns around the idea of with the vaccines and everything, how helpful they are going to be with this new variant that was found in Botswana and South Africa. Of course, Dr. Etienne will also make statements about vaccine equity and things that around that, how we need to improve that situation so that more people globally get vaccinated, and that there are more vaccines and equipment to get those vaccines available to people. She also is going to report on Canada and Brazil are the only countries in the region where the Omicron variant has been detected, but in a WHO report, it's saying that it's possible that it has circulated around the world already. So, the best thing to do, you'll hear Dr. Etienne and you'll hear Dr. Tedros and your local health officials say this, that we need to continue wearing our masks, washing our hands, and maintain that social distancing in order to truly protect us from what is to come with COVID-19 virus and its variants. So let's listen to what Dr. Etienne and her team at PAHO have to say.
Hola, muy buenos días, buenas tardes.
Good morning, good afternoon from the Pan American Health Organization headquarters in Washington, D.C. Welcome to this press briefing on the COVID-19 pandemic in the Americas. My name is Luciana Viegas, Advisor on Public Affairs with PAHO, and today is Wednesday, December 1st, 2021. We have interpretation into English, Portuguese, French, and Spanish, and you can choose your language by clicking on the interpretation button. We have already received several questions through email, but you can also ask us questions using the Q&A button during the session. Please remember to identify yourself as well as the media outlet when sending your questions. Today, Dr. Carissa Etienne, PAHO's director, will be reporting on the COVID-19 situation in the Americas and also on the Omicron variant, denominated variant of concern by WHO last Wednesday. With Dr. Etienne in this session, we have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of Health Emergencies with PAHO, and Dr. Silvaina Aldiguieri, Incident Manager for COVID-19. I would like to invite now Dr. Etienne to share her remarks with us and offer the update. Dr. Etienne.
Thank you and good morning. Thank you for joining today's press briefing. Over the last week, the Americas reported over 753,000 new COVID infections, and over 13,000 COVID-related deaths. In North America, cases in Canada and the United States remain steady but high, while infections and deaths have dropped by over 20% in Mexico. In Central America, every country except Panama has seen a reduction in cases and deaths over the last week. In South America, cases in the Southern Cone countries have increased steadily for the past several weeks. In the Andean region and in Brazil, cases are plateauing. Meanwhile, in the Caribbean, cases are on the rise in the Cayman Islands and in Anguilla. This pandemic is dynamic, and the decisions we make about upholding preventive measures and expanding access to vaccines will influence how far this virus spreads. I want to address the new Omicron variant that was designated a variant of concern by the World Health Organization a few days ago. There are still many unknowns. It is not yet clear whether Omicron is more transmissible than other variants or if it causes more severe disease. But researchers around the world are actively conducting studies to better understand this variant so that we have the best available evidence to guide our actions. Over the weekend, PAHO was in touch with health ministers in our region to share details about this new variant, and we will continue to share updates and guidance as it becomes available. The virus still needs to be isolated to conduct neutralization tests, and this process will take some time. Until this test and other laboratory assays are completed, we will not have enough evidence to determine the degree of transmissibility or severity of the Omicron variant, or to assess the effectiveness of the COVID-19 vaccines against it. PAHO, meanwhile, continues to closely track the other variants in our region, and for now, Delta remains the predominant variant in the Americas. Canada and Brazil are the only countries in our region where the Omicron variant has been detected. But it is likely that other countries will begin seeing this new variant in circulation soon. And that's why it's important that countries redouble their surveillance efforts, share sequences with the Genomic Surveillance Network of the Americas, and report any Omicron cases to the WHO. Speed and transparency are especially critical at this time. But above all, we urge people not to be frightened. Today, the most important thing that people can do to protect themselves is to get vaccinated and to reduce their risk of exposure to the virus. And this can be done by wearing masks, maintaining physical distance from others, frequent hand washing, and avoiding crowded spaces, especially indoors. It's important to note that these measures are effective against all variants, including Omicron. Countries should sustain their public health measures to limit transmission of the virus and adjust them accordingly to local transmission risks. As I've said before, vaccine inequity is prolonging the COVID crisis. And this is exactly what we're seeing with the arrival of Omicron. The more COVID-19 circulates, the more opportunities the virus has to mutate and to change. And that's why it is crucial that we expand vaccinations to all. So far, only 54% of people in Latin America and the Caribbean have been fully vaccinated against COVID-19. So our region remains especially vulnerable. But COVID is not the first infectious disease that has shaken the world. For more than 40 years, scientists, countries, and communities have been grappling with the HIV epidemic. Today, as we commemorate World AIDS Day, PAHO honors those who lost their lives to this disease and those who over the years have fought for new tools to protect those living with HIV. Across Latin America and the Caribbean, 2.4 million people are living with HIV, and just 81% of them know their HIV status. With proper antiretroviral or ARV treatment, people living with HIV can keep their disease in check and avoid infecting others. But this requires consistent access to these drugs. Even before the pandemic, just 65% of people living with HIV in our region were receiving ARV therapy. And unfortunately, as the pandemic has progressed, more countries reported partial disruptions in services for antiretroviral therapy. But countries in the region, including ministries of health, civil society organizations, and international cooperation agencies, work together to maintain the supply of antiretroviral drugs for people living with HIV and for HIV prevention. They piloted innovative methods to get those who need it, such as dispensing multi-month supplies, loans between countries, and activating special procurement procedures. While regrettably our region is falling behind on the 2030 targets to reduce new HIV infections and to eliminate AIDS-related deaths, we have made significant progress. We also have effective drugs to control HIV and interrupt transmission. And we have COVID-19 vaccines, which are proven to be safe and effective for persons living with HIV. So now we must ensure consistent and equitable access to these powerful tools. But expanding access is only possible if we combat the persistent stigma and discrimination that keep health services out of reach from too many men who have sex with men, transgender women, and sex workers across our region. And that's why our AIDS elimination responses must reflect the cultural and sexual diversity, the gender equality, and human rights, with the active participation of the communities most affected. This week also marks 119 years since representatives from countries across the Americas met in Washington, D.C. for the first International Sanitary Convention of the American Republics. That would mark the creation of the Pan American Health Organization. For 119 years, PAHO has been working closely with countries in the Americas to generate knowledge, to guide public health actions, and to support our goal of health for all. Our anniversary reminds us of the importance of solidarity and collaboration to protect the health and well-being of our region, especially during health emergencies. We made a lot of progress in treating HIV/AIDS and developed effective vaccines to protect people from COVID-19 in record time. Now we must work together to finish the job and fulfill the promise of today's life-saving tools, so everyone in our region has access to the services and tools that they need to live healthy and productive lives.
Thank you, Dr. Etienne. We received a lot of questions on the variant Omicron, as expected. The first question is for you, Dr. Etienne. What is PAHO doing to track Omicron and other variants, in the Americas?
So thank you for this question. As I mentioned, we have informed health ministers over the weekend of developments with this new Omicron variant that was reported by South Africa on November 24th. And we have asked them to accelerate vaccination efforts and to continue with crucial public health measures. Today, the Delta variant continues to be the most prevalent one in our region. And no matter which variant, we urge people to continue wearing their masks, social distancing, avoiding large gatherings, especially indoors, and hand washing. Together with vaccination, these public health measures continue to be the most efficient actions to reduce the spread of SARS-CoV-2 virus, to reduce hospitalizations, and to save lives. Our guidance to health authorities is also to enhance their genomic surveillance efforts and to share genomic sequences and samples with our regional genomic surveillance network of the Americas. And the regional network has already performed some over 175,000 virus sequences from 26 laboratories in PAHO's member states in Latin America and the Caribbean. And this is a wide coverage. In addition to the genomic surveillance, we are also working with the laboratories to rapidly implement a molecular screening methodology for the early alert for the possible introduction of Omicron, even in countries where the sequencing is not yet fully established. So we've asked countries to continue reporting cases or clusters of cases, including any that may be associated with the Omicron variant through the International Health Regulations, IHR. But as I said, there is still much to learn about the Omicron variant of concern. We don't know if it is more transmissible. We don't know whether it causes more severe disease and how vaccines and diagnostic tests will perform, how effective treatments may be, or what clinical characteristics can be described. But we do know that we must continue to do everything that we can to reduce the heavy impact that the COVID-19 pandemic continues to inflict on our economies and our societies and our peoples. Especially now, as we get closer to the holiday season, it's more important than ever to maintain caution, to reduce the possibility of exposure to COVID-19, and to protect ourselves and our families. Now, we can do this by getting vaccinated when you're eligible and taking the proven measures of maintaining the physical distancing, hand washing, wearing of masks, in closed spaces, avoided confined and crowded spaces, etc., and ensuring good ventilation indoors. As we have stressed over these 22 months, we need to do both, get vaccinated, but also adhere to the public health measures, even for people who have already been vaccinated.
Thank you, Dr. Etienne. Seguimos entonces a las otras preguntas.
So we now move on to the other questions. We continue with the Omicron variant. We start with a general question from CNN in Spanish and La Prensa, Panama. What can we expect with this variant? What is the official information that we have so far on this variant in connection with fatality rate, transmission, and responsiveness to the vaccine? Dr. Aldiguieri. Thank you very much for those questions. I think that Dr. Etienne has shared with you quite a good deal of information. I am going to highlight and also share other details regarding specific issues. It is too early to predict the impact of the Omicron variant in terms of transmissibility, severity, or also departure from the immune response. It is too early. That variant has some of the mutations that were previously described for the three variants of concern, Alpha, Beta, and Delta. And the information that we have available so far is insufficient to be able to inform its behavior in case community circulation is established. That's the reason why currently many reference labs at the global and world level are also advancing lab tests to obtain information on its ability to transmit and also immune responses, be it natural or vaccine-induced. And here we're talking about replication, neutralization tests, and also infection capability in animals. On the other hand, it is also important to recall that no vaccine has 100% effectiveness, and all of the vaccines that have been authorized for emergency use by WHO have been efficient to protect against all of the circulating variants by diminishing drastically in a very significant fashion the risk of hospitalization and the risk of death. Given all that, we have no evidence to think that the performance of those vaccines to protect against Omicron would be different. I am going to refer to other aspects that have already been referred by Dr. Etienne. From the designation of Omicron as a variant of concern on November 26th, last Friday, work has been done to alert the countries on its genomic sequencing. And due to those surveillance systems, Omicron has been detected in 23 countries, including 2 countries in the Americas. In the 2 countries of the America, detection has taken place in travelers. They are significant cases, and we have not seen community transmission yet. So it is important to recall that the increase in the number of cases or new outbreaks have to do with factorial aspects. The emergence of a new variant is just another aspect and not necessarily the most important one. As we have already mentioned in several occasions, all of the public health control measures implemented, such as wearing masks, social distancing, and full vaccination, continue to be the most effective manner to limit the transmission of any variant of concern, and they should be maintained. Thank you. Thank you, Dr. Aldigueri. We continue with more specific questions for the Americas. For example, Melina Ochoa from TV in Mexico City is asking, in what countries of the Americas has the new Omicron variant been detected, and whether this new variant will speed up new outbreaks in the region? I think that I have already addressed that when I answered the previous question. As Dr. Etienne mentioned in her remarks, the Omicron variant has been detected in Canada and in Brazil, with few cases, reported cases, and quickly reported the National Health. However, we have also mentioned that we have several actors for an increase in trend, and also the introduction of the variant is one of the factors, but it is not the only factor right now. Thank you. Thank you, Dr. Aldigueri. Now we move on to the next question. Valencia, BBC World, and others are also asking, what are the early measures and recommendations to be taken into account against the Omicron variant? And also Deutsche Welle, how is Latin America preparing for the arrival of the new variant? Will there be a shared response? Dr. Ugarte. Thank you, Luciana. And I would like to also thank the journalists for these very important questions. It has been said several times, but it is necessary to repeat that one of the most important elements to control a pandemic, in particular COVID-19, is by having timely, proper information that is highly reliable. It means that the countries are increasing and need to increase even more their epidemiological and genomic surveillance so that they are able to timely detect circulating viruses in the countries. When they are looking, they can find. So if we cannot properly, if they are not properly looking for that, detection may be delayed. And as the director and Sylvain already mentioned, it is important to work with the regional genomic surveillance network. And together with detection, we also need timely reporting. The example of South Africa and also what we saw in other countries that have reported new variants seems to be a sort of a penalty, a sanction for those countries that have already reported the variant. And in that regard, it is important to mention that those countries that are timely reporting are protecting all of us. And this is a special call to all of the countries in our region for us to continue to look for the variant and to report it timely for those who receive the information instead of penalizing or, for example, avoiding trips to the reporting countries. They should be supporting the efforts made in those countries because that's the way to protect everyone. Timely reporting is a key element that should be not only enhanced within the country, but also include patients. If a patient has symptoms, that patient should be reporting the symptoms. If there is a confirmed COVID-19 case, that has to be reported within his or her family and also the immediate contact so that everyone can be protected. To increase vaccination is key because it has also been seen that vaccination is proper to protect against deaths and severe cases in a very significant fashion. The wearing of masks continues to be very important, but only if it is properly done and continuously done when one is in public spaces or close to other individuals who might be infected with the disease or who might be transmitting the disease. Also, avoiding poorly ventilated spaces whenever there are more individuals to avoid crowded spaces are key, as well as hand washing. So all of these aspects are the early measures that have been effective, that have proven to be effective for the previous variants and that will continue to be effective for the next variant. As to the regional response, it is very important to acknowledge that the region of the Americas has one of the most significant genomic surveillance systems. We have a genomic surveillance network that is that works together with the organization in training the staff and also in exchanging information on cases and reporting. So all of the countries working on this are countries that are contributing to the safety of our region. At the same time, the countries are preparing their own health systems given potential increases in the number of cases, and that surge in the number of cases may happen in several countries at the same time, even with Delta. So it applies to Omicron, but also to Delta and any other variant. The exchange of timely information as well as the solidarity that has already been shown by exchanging vaccines, equipment, and providing technical support are key. In the region, Dr. Etienne has also mentioned that she sent a note to the countries, and the follow-up to that note is being prepared as one of the discussion topics in the next meeting of ministers that the doctor systematically holds with the ministers, and next week this will be addressed with the ministers to be able to contribute to a shared response in the Americas. Thank you.
Thank you, Dr. Ugarte. We have a question on vaccines. Yerson Collave from El Comercio Peru asks, the information regarding inactivated virus vaccines such as Sinopharm and its effectiveness vis-a-vis the new variants is limited. Does PAHO have some updated information about this? And his second question is whether low coverage in some areas in the world, specifically in some countries in the region, may generate a scenario which would lead to the emergence of a new variant in Latin America with the characteristics of Omicron. Yes, thank you very much. Yerson, the first question, my answer is this. We are still reviewing the information. At this point in time, we have groups and collaborating centers of PAHO and epidemiologists who are reviewing all the data. We do not have any evidence that out of the vaccines we have today that they won't work for the Omicron. No, there's no information in this regard. So we need to continue to vaccinate. The more we vaccinate the people, the more the coverage of vaccination, then people will be more protected against all the variants of concern that we currently have. So it is very important. There are many rumors saying that, that this vaccine doesn't work, that other vaccine doesn't work. But these are rumors. To this point, they're just rumors. There are certain studies that are being carried out. And I think within 2 to 3 weeks, we will have more valid, accurate information about the ability to neutralize the new variant with the antibodies generated by the vaccine. But until we have more information, we should continue vaccinating. Yes. Regarding the second question, PAHO from the beginning has underlined that if we don't achieve more equity and vaccine access, this will be a risk for everybody. So no matter if a country has 4 or 5 doses of the vaccine given to their population, if we still have some countries where their populations, especially the most vulnerable ones, are not getting vaccinated. So we need to, we will always have a risk in any part of the world. In Latin America, we detected the Gamma variant, which was identified initially in Manaus, Brazil, and it was a variant of concern, and it's a risk that can occur in any place in the Americas, in Asia, in Europe, no matter where. So the best guarantee we have is to continue to give vaccination, to provide vaccination to people. Thank you, Dr. Barbosa. There is a question about control measures from Ciro Pimentel.
Pergunta sobre informações a respeito das medidas de controle e a posição da OMS, OPAS, no que diz respeito ao fechamento de fronteiras e aeroportos.
The question is about the borders or control of borders. So the question is to be answered in Spanish or Portuguese.
I will answer in Spanish. Since 2020, WHO and PAHO have promoted an approach based on risk reduction to adopt measures related to international travel. This is part of a holistic response to the COVID-19 pandemic. The WHO guidelines regarding international travel has been updated yesterday on November 30th. It's important to remember that the factors that determine the decision and the package of response measures include a series of key factors. First of all, the epidemiological situation of the country itself. Secondly, the capacity of response in the country with itself to implement public health measures, as well as the response capacity by the health services. In addition, it includes accuracy of information, the accuracy that is available regarding what is going on in other countries in the world, and also, very importantly, the characteristics and the dynamic of the SARS-CoV-2 viruses, including the variants of concern and knowledge about it. At present, the characteristics and the dynamics of the Omicron variant that has been recently detected are still surrounded by questions and unknowns. And so, given that there has been an early alert and the reported information according to the international health regulations, it justifies that certain countries have taken measures related to international travel, measures which are related to a principle of a precaution in an environment of uncertainty. As more information is known about the characteristics of the disease caused by the Omicron variant of concern and its transmission and dissemination throughout the countries, they will continue to accordingly modify these guidelines regarding international travel. Thank you very much. Obrigado. Thank you very much, Dr. Aldeguer. Now, a question from Alina Dieste. Appearance of Omicron has led to a renewed debate on the anti-COVID mandates. Do you think that the COVID vaccination should be mandatory? Now, also, we have heard that there is the lack of vaccination and other factors lead to a toxic cocktail. Dr. Barbosa, can you answer this question? Well, I think the question is not if vaccines should be mandatory or not, is how can we have people get vaccinated? Because in Latin America, there is no hesitancy regarding vaccination. There is no anti-vax movement. The response of people in Latin America when they have access to vaccines is excellent. Many countries in Latin America have more people vaccinated than in the United States, for example. When we take a look at the data, even broken down by age groups in many countries in Latin America, the first groups that started to be vaccinated, those over 60 years of age, they have about 95% vaccine coverage. So I think the larger question here is to identify what groups are being left behind, what do we need to do to reach more vulnerable populations? How should we clarify among everyone the need to complete their vaccination schedule, because many people believe that with one single dose they will be protected, and this is not true. If we have, there is only one vaccine with a single dose, which is the Janssen vaccine. All the other vaccines need at least 2 doses for full vaccination. It is also a recommendation that for Sinovac and Sinopharm, it is recommended for elderly people to take a 3rd vaccine, as well as for those people who have some immunological disorders or immunocompromise. So in each country, you need to realize what the reality is there. So what do we need to motivate more people so that they get vaccinated? And to guarantee that this progress that has been made in Latin America can continue so that the higher level of vaccine coverage can be achieved. Regarding the other issue, as part of the response, broadening of access to the tools we have for, and testing is a significant part of this response to monitor community transmission of the virus in each country, so that early measures can be adopted, because if tests are accessible to everyone, when a person has a positive test, then they can go into isolation, so that they cannot infect contacts, early contacts, and so contact tracing can also be carried out. We have also spoken about this topic regarding vaccines. To leave populations without access to vaccines is somehow to lead to the possibility of new variants emerging, as WHO and PAHO have underlined many times already. Yes, there will always be the possibility that new variants emerge. This is something that cannot be prevented, and we cannot say when new variants are going to emerge, but we do know that if we increase vaccination rates, in addition to vaccination, we maintain protection measures such as the use of masks, hand washing, keeping social distance, avoiding crowds, and other measures. If we maintain these, I repeat, we will be able to achieve transmission control, which is the best way to not have new variants of concern. Thank you very much. Thank you, Dr. Barbosa. Now a question, two questions, one from Guatemala, asking Daniel Collin from TN23, what action should Guatemala take regarding the threat of the new variant, taking into account that transmission in the region has decreased, and this has led to relaxing the measures in the community. Irene Hartman also asked from Clarín, Argentina, I would like to know what are the effects of Omicron in a country such as Argentina, which hasn't had an uncontrolled increase in transmission with the Delta variant as has been foreseen, and where no social measures are being kept regarding COVID or against COVID. Dr. Aldeguerri, my answer will be combined with some of my prior responses today, including those related to travel mandates or travel guidelines. And so regarding the first question, Guatemala, any way in which you mitigate risk for travel, this has to be part of the the country's policy regarding travel. And it includes guidelines which were published in November 26 and updated November 28 in information given on real time by the health ministries of the region, as Dr. Etienne mentioned. So strengthen surveillance, including genome sequencing matters, not only for travelers, but also among the community, not focusing exclusively on travelers, but having a very clear idea of what is going on in the population in general. To share genetic sequences and all the associated information on the public platforms that exist, also to report cases or conglomerates associated to variants with PAHO or WHO through the well-known channel of the IHR, the International Health Regulations, and coordinating with the international health community to carry out field studies and lab studies in order to improve our knowledge of the impact of variants regarding dynamics of transmission, severity of disease, infectivity, and effectiveness of public health measures, and also keeping track of the immune response and of other characteristics of the virus. Now, regarding the second question, how, or based on what I said before, countries will have to continue to gauge their public health measures as well as social measures, depending on the evolution and the dynamics of the situation at subnational level as well, and to emphasize public health measures which need to be managed at subnational level, national level, and regional level. And also related to the Argentinian question, while the principle of gauging public health measures applies to different epidemiological contexts, PAHO continues to recommend the use of masks in closed and public environments regardless of the vaccine status of people. Thank you. Thank you very much, Dr. Aldeguerri. Now we have a question about vaccination in the region. Jairo Chacon from Voz de las Americas and Elisa Martins from O Globo in Brazil. They ask, how is the vaccination doing in the countries of the region in the Americas? Maybe Dr. Barbosa, you can give us an update of the status of vaccination against COVID-19 in the Americas. Yes, thank you very much. Regarding this, with all the efforts to have more vaccines through the COVAX mechanism, and it is important to recognize that in the last 2 months, we have made efforts to increase donations from the United States, Canada, Spain, France, Japan, and other countries. And we had a significant increase in the number of doses. We still need more vaccines. The goal that was established by WHO to come to the end of the year with at least 40% of the population vaccinated, we already have 20 countries in the Americas who have gone past 40% of their population vaccinated, but we still have 15 countries that are under this goal of 40%. We already have in our region four countries with more than 70% of their population vaccinated, but we still have 2 countries in the region which have not reached 20%, and this 20% are the most vulnerable groups. So progress is being made, but there is still a persistence of a situation of inequality and inequity in access. So we need to continue to strongly advocate, so that all countries may have access to vaccines and they may be able to complete vaccination of their population, and which, together with the public health measures, is the best way to respond to all variants of the virus and provide protection to people, save lives, and avoid more community transmission. Thank you. Thank you very much, Dr. Barbosa.
Rachel Scott from the Nassau Guardian in the Bahamas asks if the Bahamas is one of the countries not on track to meet the 40% vaccination target by the end of the year. What recommendations do you have for countries facing issues in meeting the targets, particularly where vaccination hesitancy is a prominent issue? Dr. Barbosa, for you maybe.
Yeah, thank you. No, thank you for this question. I think that is important to recognize that in the Caribbean, is a different situation that we have had in Latin America. Unfortunately, we have identified with surveys among the population, even among the health professionals, that there is some vaccine hesitancy in many countries in the Caribbean, and this is a barrier because even when the vaccine is available, the families, communities, people, they are not willing to get vaccinated. So PAHO has been working with all the ministers of health in the Caribbean to establish a proper communication strategy to address the health professionals, to address the communities, in order to provide transparent and direct information about the vaccines, to show the process that a vaccine has to perform to receive the emergency use listing authorization from WHO. The producer needs to prove that the vaccine is produced under the highest standards of quality, and that this vaccine is safe and is efficacious. So we are working with the countries in the Caribbean to increase the information, the communication, the mobilization of their population to get vaccinated. The Bahamas asked the COVAX to purchase the vaccines that correspond to 20% of their population. Bahamas has already received the 158,000 doses that correspond to this 20%. And now, using funds from donations from Canada, from Colombia, and using also the national resources, we are purchasing on behalf of Bahamas, using the alternative that was launched by PAHO, the direct purchase through the revolving fund, another 96,000 doses. 48,000 will probably arrive in December, and 48,000 in the first quarter of next year. So Bahamas probably, we hope that we will achieve this year more than 40%, with this combination, having more access to vaccines and also explaining and have a good communication strategy to invite people to come to be vaccinated, to save lives and to reduce the transmission. Thank you.
Thank you. Muchas gracias, Dr. Barbosa. Recibimos algunas preguntas.
Thank you, Dr. Barbosa. We have some follow-up questions regarding the time for studies or how long the studies will take. Estela Palomon from Associated Press wants to know, and this is regarding the Omicron variant, how long will it take for studies to be ready to determine whether the new variant is more transmissible and will cause more severe disease? Dr. Aldigueri, could you comment on this? Yes, I understand. I understand that there's a great deal of interest among journalists on this topic. Let me remind you the timeline of what has happened. This variant was detected on November 24th by the authorities in South Africa, and it was characterized as a world situation in last Friday. So just a few days have elapsed. I would like to underscore the complexity of doing complementary studies such as neutralization. We need to isolate the virus first, to culture the virus, and to expose it from convalescent patients or vaccinated patients. This is the team that we are using. This requires 1 to 2 weeks before we can have the first results. Of course, the countries that have more cases, more groups studied, more virus, they can do these studies more quickly. But let me emphasize that the most important thing is international collaboration, which is what is happening now under the leadership of the SAGE, with the group of advisors from WHO. And I hope I have responded with this to your questions and concerns. Thank you. Thank you, Dr. Aldigueri. We have a question in Portuguese now regarding the vaccines.
Dr. Barbosa quizás puede contestar en português.
Dr. Barbosa maybe can answer in Portuguese.
Gabriela Custódio, O Povo from Fortaleza. The question is, what are the main challenges faced in the region of the Americas in the promotion of equity access to vaccines? So the question is if the experience that's been acquired throughout the years with the revolving fund of PAHO, if it's been some benefits have been found in the context of COVID-19 to promote vaccinal equity, and if some differences between other vaccination campaigns that they've been working with the revolving fund, what are the differences?
Thank you
for the questions. I'm going to answer in Portuguese. The revolving fund of PAHO is 42 years old. So thanks to this fund, the region of the Americas, Latin America, and the Caribbean, they have been pioneers in implementing new vaccines, for example, against meningitis, against the HPV virus, pneumococcus. So our region was the first region to implement them, because with regional purchase by the revolving fund, you can get better prices. So what we do in terms of vaccination is not just procurement, but it is also a very broad technical cooperation with our countries in the area of vaccination, be it from the review of national plans, technical recommendations, training of practitioners. So the whole set of activities that are in favor or helping vaccination. So in the case of vaccination against COVID, I have given the data on inequality, but the main hurdle that we have been facing is that vaccine producers, manufacturers, they have prioritized delivering vaccines to the countries that did direct purchasing, because in those direct purchases, they sell it for a higher price. So giving you an example is that the rotating fund or the revolving fund has been doing that with the manufacturers with the RNA messenger vaccine that they are producing now. We have a price that's $5 per doses, which is lower than the bilateral countries that were signed with Latin American countries. So it's very important for countries to join the revolving fund, because that will generate higher volumes. And in this case, we then can get lower prices for all countries, benefiting then the entire region. So the revolving fund is a purchasing mechanism for the COVAX mechanism, but we also offer the alternatives for direct purchase for countries that want to reach higher vaccination rates. So they can buy through the fund, the COVAX fund, and then buy indirectly from manufacturers. Thank you very much. Thank you, Dr. Barbosa.
We have one more question on vaccines for you. For today is a question from Meredith Wadman from Science. She asks if the Novavax protein vaccine wins regulatory approval, which may happen soon in Europe. Would you see it being rapidly approved by PAHO, in PAHO countries, why not? And how important of a role, if any, might this new vaccine, Novavax, play in these countries in the region? Just a quick comment, perhaps, Dr. Barbosa.
Yes, I will make it very brief. The decision to authorize a vaccine in one country is made by each national regulatory authority. So there is no role of PAHO to authorize a vaccine in Argentina, in Brazil, in Mexico, in Colombia. This authorization is made by each national health regulatory authority. The WHO has a pre-qualification team that is assessing the vaccines and releasing the emergency use listing authorization. It's an authorization to use in a public health emergency, like the pandemic. So far, we have 8 vaccines that have received this authorization. Novavax is being assessed. We don't know if it will have 1 week or 2 weeks or 1 month, because this is a process that the WHO requests information from the producer, and the producer needs to provide all the information to the assessment be performed. Of course, that we welcome every vaccine that wants to receive the authorization from WHO, because these vaccines are the vaccines that we, PAHO, are authorized to purchase through the revolving fund. So if we have more vaccines, it will be better, because we will have more vaccines to be offered through the revolving fund to our member states. Thank you.
Thank you very much, Dr. Barbosa. We are coming to the end. Llegamos casi al final de nuestra sesión. Tenemos una última
This is the end of our session, and we have a final question from Vera Lochner from Revista Tercer Sector Argentina. It's a general question. Can we learn, or what lessons can you say we have learned from the COVID-19 pandemic? And it's a question for Dr. Etienne.
What health lessons can you say that we've learned from the pandemic? Dr. Etienne, please, a final question for you.
Thank you for that question. It's still early in this pandemic, and we cannot be sure about many things. We have been surprised time and again by the SARS-CoV-2 virus, its rapid spread, its devastating effects on public health. But we have learned some lessons that are already being addressed as we begin to be ready for a new pandemic. We have learned that science is crucial in this battle. And we have seen that vaccines work and that public health and social measures work to limit COVID-19. It is very clear that the world was unprepared for a pandemic of this severity and magnitude, and that critical measures must be put in place at the international, national, and community level to prepare for the next pandemic. And the discussions in the special World Health Assembly that happened just this week were towards addressing this level of preparedness. The pandemic has also proven unequivocally that health and well-being are crucial for economic growth and development. We also recognize that the region of the Americas is very dependent on other regions for the production of medicines, vaccines, and other health technology, including PPEs. And that efforts must be made to expand the region's production capacity in a coordinated manner. The region only produces 4% of the health technology that it uses. We have learned that our healthcare systems must be strengthened, particularly at the primary care level, and also to ensure the essential public health functions. It is true that one surprising lesson, particularly in the Americas, has been that some people are reluctant to get vaccinated because of misinformation that they've read on the internet or other places. And this hesitancy has really set back our efforts to protect populations against this disease. It is clear that we have to do better in communicating with people on the importance of avoiding severe disease and death with safe vaccines, but also with adhering to the public health and social measures. Another thing that we've learned is that PAHO, which brings together health officials from all over the Americas and has been doing so over the last 119 years, that PAHO has been crucial in the response to the pandemic. We have disseminated information, but importantly, we've unified the countries. We've helped with the procurement of vaccines and equipment, and these have been key tools in protecting our people, but always pulling our countries together and working in a coordinated manner. Our push to prioritize health workers for vaccination, I think, was another valuable lesson, as it protected our doctors, nurses, and allied health personnel, so we could continue with the capacity to care for the population. We have also learned that speed is essential. We have to respond quickly and adapt to changes in the patterns of the pandemic, as we are facing Omicron now and having to act to learn quickly, and we will probably have to adapt if that is necessary. I think without PAHO, this would have been much more difficult in the region. An important lesson is that health is global and international cooperation is essential. We have to continue working together because we won't be safe from COVID-19 until everyone is safe. Equity and solidarity are really essential to help halting this pandemic. So thank you again for joining us for today's press briefing. I think that we've had a rich discussion, and we will continue to give information on Omicron to our press briefing as these become available. Thank you once again.
Thank you very much, Dr. Tien, for those final words.
Thank you, Dr. Etienne, for your final words.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.